Welcome to Chapter 4, Carbohydrate, Sugar, Starch, Glycogen, and Fiber. Diabetes Part 2 by Professor Tammy. Learning objectives. 1. Understand how to read food labels. 2. Briefly summarize hypoglycemia.
I want you to go over the food labels. Pay attention to the serving size, which is here. The calories. Also, I want you to be able to calculate all these if I was to ask you a question about the food facts label. High blood glucose. 1. After a meal, blood glucose rises, signaling the pancreas to release insulin into the bloodstream. 2. Insulin signals the fat, the adipose tissue, and skeletal muscles to take up glucose from the blood. It also stimulates glycogen storage by the liver. 3. Blood glucose falls to its normal concentration. 4. In response to normal blood glucose, the pancreas slows its insulin output. So if you have low blood glucose, as body cells use up glucose, body glucose declines, signaling the pancreas to release glycagon into the bloodstream. So this way, that's the hormone that breaks down the stored glucose into glucose. Glycagon signals the liver to break apart its stored glycogen, releasing glucose into the bloodstream. Blood glucose rises to its normal concentration. In response to normal blood glucose, the pancreas slows its glycagon output. So you can look at the picture how, glycogen is stored in the muscles and in the liver. If I feel dizzy between meals, do I have hypoglycemia? Well, it's important to control your carbohydrate intake. The amount rather than the source seem to matter more, like how much carbohydrate you intake. Carbohydrate recommendations varies with glucose tolerance and carbohydrate timing. There's also rare diseases and normally low blood glucose, and there are symptoms with that, and the causes are poorly managed diabetes, medications, alcohol abuse, etc. Hypoglycemia. The cause is too little food or skip a meal, too much insulin or diabetes pills more active than usual. The onset often sudden, may pass out if untreated. So these are some of the symptoms: shaky, fat, heartbeat, sweaty, dizzy, anxious, hungry, blurry vision, weakness or fatigue, headache, or irritability. And hypoglycemia means low blood glucose, because hypo means low and glucose, glycemia means blood. So here's hyperglycemia, so high blood sugar. So the causes can be snacking on food, higher sugary levels. And here are some of the symptoms: extreme thirst, frequent urination, dry skin, hunger, blurred vision, drowsiness, nausea.
See you soon, and remember to read the book.